Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Mental health is an integral part of overall well-being, yet it often remains overlooked, especially when associated with medical conditions that primarily affect the body. Among such conditions is polycystic ovarian disorder or PCOD, which brings with it not only physical challenges but also emotional dimensions that deserve equal attention. Understanding the mental health aspects of PCOD is vital as it opens the door to more compassionate care and a holistic approach to health. By engaging in this discussion, we acknowledge the importance of addressing the mind alongside the body, ensuring that patients receive the support they truly need. Welcome everyone. I'm Dr. Soumya Saluja from THIP Media, and today we bring forth a very important discussion on PCOD and mental health, dealing with anxiety and depression. And to guide us through this crucial conversation, we are joined by the esteemed health expert, Dr. Desiree Saimbi. Dr. Desiree Saimbi is a distinguished psychiatrist with over a decade of clinical experience, currently serving as a senior psychiatrist at Sant Parmanand Hospital, Civil Lines, New Delhi. She earned her MBBS from Barakallah University, Bhopal, and pursued her MD in psychiatry from People's University of Medical and Health Sciences, Bhopal, where she was awarded a gold medal for her academic excellence. Over the years, Dr. Saimbi has held pivotal positions at leading institutions, including King George Medical University, Lucknow, and St. Stephen's Hospital, New Delhi. Her clinical expertise spans a wide spectrum of mental health conditions such as anxiety disorders, depression, obsessive compulsive disorder, addiction psychiatry, and adolescent mental health. She is a respected member of the Indian Psychiatric Society, Delhi Psychiatric Society, National Academy of Medical Sciences, and holds the distinction of being an international fellow of the American Psychiatric Association. She has also served on the executive committee of the Indian Psychiatric Society for 3 consecutive years. Recognized for her compassionate, patient-centered approach, Dr. Saimbi has received numerous accolades, including the prestigious Dr. S. Mishra Award from the National Academy of Medical Sciences. Her conviction that health literacy improves doctor-patient communication reflects her commitment to advancing mental health care and making a meaningful impact on society. Dr. Desiree, THIP Media welcomes you, ma'am.
Thank you so much.
Thank you so much for your time today, ma'am. Ma'am, we all understand PCOD is a condition that affects women, many women out there these days. And while its physical symptoms, they are widely acknowledged, the mental health challenges, particularly anxiety and depression, they're often less spoken about. Yet they form or they constitute a very crucial aspect of a patient's journey and overall well-being. So, in the spirit of bridging this gap and understanding the emotional aspect of PCOD more deeply, I would like to begin this discussion with a very fundamental question that what are the most common mental health issues observed in women with PCOD? And how would you say they are different from mental health issues associated with PCOS?
Right. Lovely question. So I'll just I like explain the two disorders, the PCOD and the PCOS. So PCOD is a disorder, polycystic ovarian disorder. PCOS is a syndrome, polycystic ovarian syndrome. So out of the two, the syndrome happens to be more a severe disorder because it is more metabolically related, more endocrinologically related, whereas the PCOD is usually a lifestyle disorder. Obviously, genetics would also be playing a part there, but that's considered some comparatively a less severe disorder. So if you come to the mental health aspects of both of these, both of them have the same mental health disorders, so nothing there differs. But coming to the mental health disorders that are common in such a category of patients is usually depression being first, and
Okay.
the second being anxiety disorders, and the third being eating disorders. So patients, they tend to fluctuate between dieting and overeating. So that's why we consider the eating disorders also quite important to be evaluated in these patients.
Right, ma'am. And you just
Mm.
mentioned that both of these, are completely different things. Though PCOS being a slightly, comparatively serious condition in women, you usually don't consider that the distinction in terms of the mental illnesses. What about the contributing factors here? Would you say that the hormonal imbalance associated with the two could contribute to the psychological symptoms that you just mentioned of anxiety and depression?
Right. They definitely contribute. The hormones and the chemicals are deeply interconnected to each other in our own bodies and brains. So there's
Ji,
one thing known as the HPA axis that everyone is familiar with. So the HPA axis tends to get overly stimulated in the PCOD patients or the PCOS patients.
ji,
So once the HPA axis is getting overstimulated, there's more amount of cortisol, which is called as the stress hormone. That gets more excreted in such a category of patients. So when we have more amount of cortisol in our body, so obviously the stress symptoms tend to become more evident. But that doesn't happen just one day. It happens over a period of days. So high cortisol is related to in PCOD. If you talk, it is related to increased amount of androgens, increased amount of inflammation. It is resulting in insulin resistance and like all insulin resistance plus fertility issues. So cortisol in this way is related to the PCOD.
ji.
And once the androgens are high, they cause the decrease in a neurochemical, which is essential for the mental health symptom that is known by the name of serotonin. So when the high androgens are circulating in the body, due to the hormonal imbalance, there's high cortisol and there is low serotonin in the body and the brain. So a cluster of mental health symptoms tend to come up along with the symptoms the PCOD is already having.
Right, right. And would you say that there are any particular age groups or life stages when women with PCOD in particular are more susceptible to mental health issues?
Right. So PCOD is a disorder of the reproductive age group. But
Ji,
coming to this part of your question, specifically, if I say adolescent age group is more vulnerable, and the second followed by the adult age group. And many times we also consider the perimenopausal women in the category of PCOD.
ji, ji, ma'am. And like you just mentioned that adolescents, are usually affected by
Mhm.
the PCOD related mental health issues. So, thinking of adolescents, I also think about the, the self image or the body consciousness
Mhm.
things that this particular age group is actually struggling with. So,
Mhm.
how significant is the role of body image and weight concerns in exacerbating anxiety or depression, in
Mhm.
patients with PCOD?
That's such a lovely question. See, living in a social world now, which is so, socially, everybody's so social conscious of their images. Imagine how a person with the PCOD who's developed hirsutism, acne, hair thinning, how they would be feeling walking around with other general people. So yes, the negative body image plays a very important role in development of anxiety depression. Why? Because it lands up the patient into a low self-esteem cloud, and then that lands up the patient into negative thinking pool, and confidence decreases overall. They start being too judgmental of themselves. They feel less
Yes.
desirable. They also question their fertility and their femininity. So all these things are all make the patient a bit gloomy and negative about their own self, and many a times these kind of thoughts are also the precipitating factors for development of anxiety. And if the patient is staying and harboring under such kind of thoughts over a long period of time, so obviously chronic amount of worries, chronic amount of stress is causing cortisol to be released in the body, and over a period of time, that also predisposes a patient to develop anxiety or depression.
Right.
So it's strongly related.
Right, right. And because it is induced by hormones, especially the sex hormones in a female's body. Can you describe how irregular menstrual cycles and fertility concerns, affect one's emotional well-being in this particular condition?
Mhm. Right. So, see, the fertility obviously is getting affected due to the impaired LH and FSH being released and obviously the ovulation is not being able to be pinpointed. So, this is very important for anybody who's, planning pregnancy. So, they start feeling very, like uncertain about when the family planning could be done. So, that is one thing. And the second thing is because of the unpredictable nature of the irregular menses, the patient doesn't know, when it could just happen. So they tend to avoid certain social activities also. That lands them up into, social isolation. So a lot of these, like kind of worries come around when there is irregular menses and fertility issues. Also the social, like the society where we are living, people are not very well versed with a lot of medical disorders. So they don't know what the patient could be having, why the patient is not able to conceive. A lot of societal pressures also add on to a woman's mind. So all of this can exacerbate a lot of the emotional symptoms in a patient.
Right. And the ones who are undergoing a particular treatment, for example, somebody diagnosed with PCOD has been prescribed a certain medication for their condition. So now, would you say that certain specific medications or hormonal treatments for PCOD patients may positively or negatively impact their mental health?
Right. So, see, any medicine that we consume is obviously made to heal us and help us. Right. So, side effects are not of much concern in such patients. But the only thing we have to remember is that they develop metabolic syndrome. So, we have to be careful not to use medicines that could exacerbate their metabolic condition. So, that is the only negative impact I would like to mention. Other than that, everything else is positive. So, whatever we, use antidepressants, anxiolytics, everything goes a long way in the patient's recovery journey from PCOD. And many a times the hormonal treatment used for PCOD in itself could also, at root level, correct a lot of, the hormonal and the neurochemical interconnection that was missing. So, like, we say metformin, which is used for insulin resistance in PCOD patient, really helps in treatment of depression indirectly, as it improves the neurogenesis in the brain. It improves the brain and the gut, interaction. So, all of these things definitely help the patient in a positive way, and it really helps in the recovery journey. So, they should go for medications.
Right, right. And like we've just discussed, a very important section here that women are socially pressurized for certain reasons, be it fertility concerns or their body image. Would you help us understand any other identifiable lifestyle or environmental factors that, could worsen mental health symptoms in PCOD patients?
Yeah, so obesity is one. Any obese person is more predisposed to development of both PCOD exacerbations and mental health issues. Sedentary
Right.
lifestyles, then poor family support, poor social support, and
Gee.
you could also consider poor sleeping habits, poor dietary habits, poor lifestyle habits in all. So
Okay.
these could be the factors contributing.
Okay, right. So basically,
Yeah,
unhealthy life choices.
right, right.
All of these are very significant contributors here, right?
Mm,
And now, ma'am, what if someone who's struggling, with PCOD
mm.
related mental health issues, and they would come to you for help? How would you say, is early screening and timely diagnosis of such mental health conditions is significant, in the management of, overall management of PCOD patients?
Oh, see, that really goes a long way in the treatment journey of the patient. So, if the patient comes early, we have a good golden window period to treat the patient early and to
Right.
control symptoms from, progressing. because obviously things when they proceed they become severe, and then there's a lot of complex treatment management that comes into play. We can't just treat patient from a single medication. And
Ji,
also the early diagnosis helps the patient in the compliance. And so it really does help. The early diagnosis helps in a lot of ways in treating
ji.
the mental symptoms.
Ji, ji, ma'am. And of course, we've just understood, the role of cortisol, in patients which usually are, at a higher or an elevated level in PCOD patients. So, what role would you say stress management techniques and mindfulness or cognitive behavioral therapy play in enhancing mental health in PCOD?
Yeah, so as you mentioned, the CBT and the mindfulness, these are all designated unique approaches in the treatment of mental health disorders, and they
Right,
really help in reducing the stress levels and increasing the emotional resilience in a patient.
ji,
So we should definitely use these therapies as help, and just dedicating yourself 10-15 minutes every day for simple, maybe, if you know mindfulness, go ahead with that. If you just don't know anything else, just do simple meditation and deep breathing exercises. All of this also reduces the cortisol in your body, and it gives you a calming effect. So
right.
these are like, all these are supportive therapies, they should be tried.
Right, right, ma'am. And would you suggest your patients any dietary and exercise interventions that you would say would be beneficial for them in terms of their physical and mental health?
Right. So, see, diet which is light on the gut really helps, and in specifically for PCOD is the Mediterranean diet that we recommend. Also, they should be careful of the carbohydrate intake. So, complex carbohydrate intake really helps them for PCOD. That just simply comes from normal fruits and vegetables.
Ji,
And if you talk about the mental health symptoms, they really help with the intake of banana, a daily banana, and
right.
papaya, dark chocolate, dates. All these are specifically helpful in increasing the serotonin in your brain. And that
Okay,
serotonin is just known as the happy hormone. So, what we are trying with the medicines, you can try by just simply eating a banana every day.
okay.
And
That's actually a very
yeah.
tasty treatment modality, I would say.
Right. And coming to the exercises, you should do any physical exercise that helps. Usually, yoga really, really helps for both the things, PCOD and mental health symptoms. And simple, JPMR exercise, which the patient can learn from a therapist, also goes a long way in controlling the anxieties. And simple things like journaling also goes a long way. And always the walk is always your best exercise. So simple, dedicated 30 minutes walking every day, if nothing else is possible, also goes a long way.
Okay, right, right. And how does family support and the broader social environment influence the mental well-being of those who are struggling with PCOD, ma'am? Would you help them here, such patients?
Yeah, the family support definitely needed when someone is suffering from any disorder. And if the family is supportive, the patient does not feel judged. The patient feels validated. Her emotions. She feels someone is understanding. Someone is able to validate her emotions. And even if the society is very supportive, it really helps her move around carefully, confidently, and people are not judging her. So all these instill a lot of confidence in the patient and help in curbing a lot of stress in her and
Right,
precipitating certain illnesses like anxiety, depression. So a positive environment go really helps. So we should
right.
always try to uplift our patients in any way and don't be very judgmental.
Right. And talking about being judgmental or let's say a positive environment, I'm sure there might be certain common myths or misconceptions surrounding around PCOD,
Mhm,
that would be, putting in a lot of mental pressure on women who are battling the condition.
mhm.
So now, could you help us understand some of these?
Yeah, so I'll just read them through because they're very interesting ones which we should talk about. So the first one I'll talk about is the mood swings in PCOD are just normal female behavior, as everyone tends to be very judgmental by saying this. Well, that is not the case. women with PCOD have higher rates of depression and anxiety, and that's a scientific fact. So they are just not simple mood swings of a female. The second myth is losing weight will automatically fix both PCOD and mental health issues. Well, losing weight helps definitely, but mental health issues can even persist after your weight management, and you would be needing a dedicated psychological care. So don't just sit over it. You should discuss it if you're still not feeling good. Women with PCOD are overthinkers or weak if they feel depressed. Well, hormonal imbalances are real factors. They are real biological things happening within a patient, and they definitely cause psychosocial changes in that woman. So these are not being just made up by her. And one more to go. If you take treatment for PCOD, mental health issues will disappear automatically. Well, hormonal treatment does help, but mental health support like simple therapy or support groups are necessary for the complete well-being of an individual. And the last one I'll mention is PCOD means you will definitely have mental health disorders. No, that is not the fact. Not every woman with PCOD will develop mental health issues. Yes, PCOD is one of the groups that is at a higher risk of developing mental illnesses. But with good coping skills and good awareness around support systems around, we can reduce the impact of PCOD on the mental health of a patient.
My
So.
goodness. I mean, this is actually making me think how much a PCOD patient might be going through mentally.
mm,
It's way too pressurizing. So, anything in terms of health literacy, ma'am, would you say that having the right knowledge would help, counter mental health outcomes in women with PCOD? And if you say so, what strategies would you suggest to improve it?
Right. So, see, health literacy anywhere, it really helps by educating a person about something. The person becomes more flexible, more aware, more acceptable to certain things. And similarly, in the case of PCOD, the patients recognize symptoms earlier if they are aware about it. They are good patients who follow the instructions of the doctor, and the compliance improves towards the adherence of the medication. So, good literacy towards an illness is really needed. And how can we increase it is simply through awareness programs, just like we are conducting one now. And also, I encourage people to talk about what they are suffering. Since people don't talk about what they have, so the awareness doesn't happen. So we should talk about our illnesses. We should share what we are feeling, what is the diagnosis. We can always discuss. We should not be behind the bars and don't discuss this. It really helps in the societal knowledge also.
Right, right.
Right.
So I would just like to close this discussion, this wonderful discussion, by asking you for a final message that you would want to give to your patients who are fighting PCOD related mental health issues now.
Yeah, so I'll just say both of these disorders are deeply hormonally interconnected, deeply rooted in your brain. So do take timely help for both of them, and simple lifestyle changes also go a long way. So if you maintain a good lifestyle, maybe you don't need to reach up to the levels of medication. So try living a healthy life, staying away from all bad things and doing good things like exercising, good mindful diet, and sleeping well, actually. So it's all easy then. Nothing is so complicated, and we're always there to help. Any queries, you should just come up to us and discuss. We can always solve it for you.
Okay, wonderful, ma'am. So, on that
Yeah.
beautiful note, we really appreciate your presence with us today, ma'am, and
Thank
I'm
you.
hoping that the enlightening information shared will be valuable to many families or many women out there. So, thank you so much for joining us. It's really been a pleasure.
Thank you so much. Thank you so much.
Thank you, ma'am. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again.